today I would like to discuss to you about cystic fibrosis. Cystic fibrosis is a genetic chronic disease that affects the secretory gland. These abnormal secretory glands will produce sticky and very thick mucus that disrupts the respiratory system. So, this mucus will block the airway passage and leads to difficulty in breathing for patients. So, what about the history of cystic fibrosis? To tell you about this, let me share with you a story about Melissa Benoit. Melissa Benoit is a girl that is born with cystic fibrosis. She spent her first month of life in hospital and is expected to live until only 20 years old. However, she succeeded and exceeded her life expectancy. This is Melissa in her 30s with her daughter. About Melissa Benoit's story, it is not possible if it weren't for the genetic breakthrough by scientists. In 1930, cystic fibrosis is first encountered by Dr. Fanconi. However, he termed it as celiac syndrome, where he sees changes in pancreas of his young patient. But the actual cystic fibrosis term is by Dr. Dorothy Anderson, and she proposed that the deficiency of vitamin A may be the cause of cystic fibrosis. The most significant genetic breakthrough is in 1989, where CFTR gene, cystic fibrosis transmembrane conductance regulatory gene, is first discovered. Our hero for this discovery is Dr. Lep Chi Sui. Here he is. His discovery is one of the most significant breakthrough in human genetics for 50 years, and he received an induction in Canadian Medical Hall of Fame for the CFTR gene discovery. Here we have a patient suspected with cystic fibrosis. So, as a patient yourself,
Yes.
what are the symptoms or the change in your body that you can feel lately?
Oh, actually, I didn't realize any major changes that happened in my body. But one thing that I realized is I've been coughing and sneezing for quite a long time, and also got a lot of thick mucus. So apart from that, I also frequently got constipation.
Oh, I
That's
see.
the symptom.
So, but you don't know the details of the
Yeah, I don't know the
disease, right?
details.
So,
So I have to go to see the doctor for more information. So I go
good.
first, okay?
So, the symptoms that I've heard is frequent, persistent coughing and sneezing, constipation, and a lot of thick mucus. So, is it true that she have cystic fibrosis?
Cystic fibrosis is a chronic disease that affects the secretory gland, which are responsible for producing mucus and sweat. Patients with cystic fibrosis are usually overproduce this mucus and they have a salty sweat. This overproduction of mucus causes malfunction in the lung, pancreas, intestine, liver, and sex organ. As we know, mucus is a watery and slippery substance that keep our organ moist and prevent dehydration or infection. So people with cystic fibrosis, their mucus are thick and sticky. So this thick and sticky mucus cause them to accumulate in the lung. When the mucus accumulate in the lung, they leads to bacteria trap and which lead to infection. In the pancreas, the mucus prevents the release of the digestive enzyme. It prevents the release of the digestive enzyme from the pancreas to the intestine. So without this enzyme, food cannot be broken down, and the intestine cannot fully absorb the nutrient from the food that we eat. So this will cause malnutrition. Okay. This also happens in the liver. So in the liver, the bile is thick. So the bile also having problem in getting out from the liver, so it is blocked. Okay, sex organ. Almost all men with cystic fibrosis are infertile. Okay. This is because the tube that connects the testis and the prostate gland, which we call vas deferens, is either blocked by the mucus or missing entirely. So it's like mostly men with cystic fibrosis are infertile, but women with cystic fibrosis can pregnant and have babies. Okay, now I will describe about other symptoms of cystic fibrosis. Other symptoms of cystic fibrosis are persistent coughing, wheezing, exercise intolerance, stuffy nose, foul-smelling and greasy stool, poor weight gain and growth, severe constipation, intestinal blockage. This usually happens in newborn. Okay, so all these symptoms are possibly happens in patients with cystic fibrosis. Even though they don't have observable phenotype, these are the symptoms that we can refer to. Okay, thank you.
Masuk.
Hello, doctor.
Hi Mira. So are you coming for your monthly checkup?
Yes, doctor.
Okay, are you feeling well?
No, I'm not feeling really well lately because I've been coughing and having a stuffy nose for quite a long time. What actually happened to me, doctor?
Okay, this is from my point of view.
Yes.
From all the symptoms that you mentioned just now,
Yeah.
and from all the tests that we have made on you, so I have to say that you have this cystic fibrosis.
Why this can happen, doctor?
Okay, before that, let me explain to you some details about this cystic fibrosis.
Yeah.
Okay Mira, I have made a genetic diagram to show the inheritance of cystic fibrosis. Actually, cystic fibrosis is caused by a recessive allele. This means that it must be inherited from both parents. So, notice that the offspring with label capital letter F and small letter f is known as carriers. So, a carrier has one copy of the faulty allele but does not have the disorder themselves. So, in this example, both parents are carriers. So, they may not know there is 1 in 4 chance of them producing a child who has cystic fibrosis, which is you, Mira. So it is possible to screen embryos to see if they carry allele for genetic disorder. So your parent must be carriers so that you have inherited this cystic fibrosis.
So, doctor, it means that I inherited this cystic fibrosis from my parents?
Yes, it is caused by a mutation on specific gene that cannot encode for specific protein. So you have this cystic fibrosis.
Oh, I see.
Cystic fibrosis is caused by a mutation in the gene of cystic fibrosis transmembrane conductance regulator, or mostly known as CFTR gene. The most common mutation is delta F508. Delta indicate deletion. F is phenylalanine. 508 is the position of amino acid in the CFTR protein. It means that a deletion of 3 nucleotide that result loss of phenylalanine amino acid in the 508 position on the protein. This mutation accounts for 66 to 70% of cystic fibrosis cases in the worldwide. However, thousands and 500 mutation can also produce cystic fibrosis. In order to indicate a person to have a cystic fibrosis disease, he or she may have both allele that is not working to produce CFTR protein. Thus, cystic fibrosis can be considered as autosomal recessive disorder. A chromosome that involved in this mutation is chromosome 7, where CTFR gene is located. To be specifically, the location is at the long arm of chromosome 7, region 3, band 1, and subband 2, or can be represented as a 7q31.2. The product of CFTR protein is a chloride ion channel that is responsible for sweat, digestive juices, and also mucus.
So, we know that cystic fibrosis is a genetic disorder that caused by mutation occurred in the gene named CFTR gene. So, the function of this gene is to code for CFTR protein. What are these CFTR protein? So, CFTR protein is actually a channel protein that function in pumping of chloride ion from the cell into the various type of secretion. So this pumping of chloride ion will help in drawn of water into the same secretion, and the drawn of H2O into secretion will thin out the secretion itself. However, in cystic fibrosis patient, as there is mutation on the CFTR gene, so the CFTR protein is abnormal. CFTR protein of cystic fibrosis patient is misfolded and it cannot bind to plasma membrane. As there is no CFTR protein bind on the plasma membrane, there will be reduced in the pumping of chloride ion into the secretion, also reducing the H2O molecule into the same secretion and make the secretion become thick. So when we have thick secretion, it will give effects to two types of organs. They are pancreas and lungs. So I will talk about the effect of thick secretion on the pancreas first. So in the pancreas, when there is thick secretion, there will be pancreatic insufficiency. Means that there will be no pancreatic enzyme produced. This is because this thick secretion will block the pancreatic duct. So when there is no pancreatic enzyme, there will be no absorption or reduced in the absorption of protein and fat, and this will lead to poor weight gain. Next, when there is no pancreatic enzyme, it will also lead to pancreas damage. How this happen? So when there is no pancreatic enzyme, there will be a backup digestive enzyme, right? So all of these backup digestive enzyme will actually damage the cell that line the pancreatic duct itself. So when there is damage of or rupture of cell that line the pancreatic duct, that will cause local inflammation. So next, talking about the effect of thick secretion to the lungs. So in the part of airways, there will be cilia. So normally, in normal condition, cilia will help to move the mucus that will trap all the debris and bacteria to move the mucus to the pharynx. But in cystic fibrosis patient, as we know, the mucus
or the secretion is thick. So it is harder for the cilia to move the thick mucus towards the pharynx. So this will lead to symptoms like cough and fever, also reduce the function of lung itself. So the repeating symptoms like cough and fever will actually lead to lung failure. One of the symptoms mentioned before is salty sweat. So why the sweat tastes salty? This is because there is a lot of chloride ion inside the sweat. So this happens, as I said before, there is mutation in the CFTR gene that cannot encode for the CFTR protein. So in the sweat glands, when there is no CFTR protein, the chloride ion cannot be reabsorbed.
So, if Mira is confirmed to be diagnosed with cystic fibrosis, what kind of treatment should she have? Let's ask a doctor here. Doctor,
Yes,
can I ask you one question?
yes, you may.
For a patient with cystic fibrosis, how can we treat them?
So that is your question.
Yes.
Alright. First and foremost, there are a lot of ways to treat this disease. For example, we can apply the chest physiotherapy. The physiotherapy helps to loosen the mucus by literally banging on the chest of the patient. Secondly, we also can use inhalers. Inhaler helps to widen the airways and make the patient become more easier to breathe. And then the other treatment that we can do, the patient can consume antibiotic and also medicine. The function of antibiotic is to help the patient from getting the infection on the chest. Meanwhile, for the medicine, we can consume medicine such as hypertonic saline to make the sticky mucus become more
I see. But what are the treatments that we can do?
We can do the personalized treatment. As we know, the cystic fibrosis disease is caused by the mutation of CFTR gene. So, with the personalized treatment, we can target the specific CFTR mutation gene. In this situation, the lumen catheter will bring the mutated CFTR gene to the cell membrane with the help of IVA catheter. It can help the protein to more better. As a result, there will be no mucus, excess mucus in our body. We also can do the genetic treatment such as genetic therapy. The function is to correcting the specific mutation. We can do this by insert the working pieces of DNA into the cell.
Earlier, cystic fibrosis is a genetic disease. However, I'm not so clear about the genetic part of this disease. So can you please explain more on that?
Yes, sure. Basically, but sorry, I have emergency call. I think you can refer to our genetic counselor, Miss Deepa.
Miss Deepa?
There.
Yeah, okay.
Okay.
You can go. Thank you. Hello, are you Miss Deepa?
Yes, I am. How can I help you?
I'm Daya. I just met Dr. Nazatul and she suggested me to refer to you regarding the genetic part of cystic fibrosis. So, I understand that cystic fibrosis is a genetic disease, but I'm not so clear about the inheritance and the genetics of it.
Cystic fibrosis is a genetic disease. More specifically, it is an autosomal recessive inheritance. Where I show you, the cystic fibrosis is affected by CFTR gene. So normally the patient who are having cystic fibrosis will having a both mutated gene of CFTR. Okay, let H is a dominant and small letter h is a recessive, which is a mutated gene. So just now the patient you met having parents with a normal appearance, right? They
Yes.
don't have cystic fibrosis, right? So they are carrier actually. So the patient is a mutated one. So the possibility to have a mutated child is 25% for carrier parents.
Okay.
You get it?
Yes, thank you for that. So, for patients with cystic fibrosis, is there any possibilities that their children will inherit the same disease?
For the children, for the patient.
Yes.
Yeah,
Future
it's
children.
Future children. It depends on the partner they are married. If the partner is a carrier, which they carry one mutated gene, so the possibility to transfer the mutated gene is 50%. Can you see this diagram?
Yes.
So,
So here and here.
yeah, 50% the possibility to having a cystic fibrosis baby. If the patient marry a normal partner with no mutated gene, then there will be no patient with mutated with cystic diagnosed with cystic fibrosis. All of them will be the carrier.
Their children.
Their children.
So my last question is, what are the precautionary steps that needed to be taken to avoid having children with cystic fibrosis, apart from choosing your partner?
Okay. During the pregnancy, the patient can having a chronic villus sampling test, which we take some of the amniotic fluid from the mother during when they are pregnant. We take somehow, so then we can test it. We can know the genotype of the baby, whether the baby is having a cystic fibrosis or not. So, are you clear about
Yes,
it?
I'm very clear about it. Thank you, Miss Dipa.
Thank you, Daya.
Okay, Mira, and we have talked a lot about information about cystic fibrosis, right?
Yeah.
And researchers have tried to find many treatments to treat this disease, and there are some ethical issues that rise among the Caucasian people. One of the ethical issues that rise among them is they want to use lung transplantations. So lung transplantation is recently introduced, as they said that this is new optimism to for the prognosis and treatment for those who are affected by this disease. But they say that this lung transplantation is have limitations, and because this treatment is relatively new procedure, and also it is a major operation that involve our important organ, like lungs is our important organ, right?
Yes.
Okay, and the other one is this treatment, transplantation, is associated with pain and discomfort to the patients, and it other than that, it requires immunosuppression therapy for the rest of the patient's life, just making the patients more suffer. And the other one, and yet some of the donors of the lung, we might have known that the donors might have infections like bronchitis, that just give more infection to the patients and give more complication to the patients. And so, Mira, do you know anything about ethical issues
Yeah,
in cystic
I've read
fibrosis?
one ethical issue involved in neonatal screening for cystic fibrosis. It's involved that if we want to do neonatal screening, we have to inform both families, because it is important, because we have to give understanding for the parents, for better understanding, and we have to tell them the limitations that might be occur from the test, and it also consequences. And there are also ethical issue rises about there are only limited choices for patients who are pregnant. The first choice is to terminate the pregnancy. The second choice is they give birth to the child and raise them as usual. So, but the first choice is give a controversial because it is actually oppose the mother's nature. Yeah,
It is unethical lah
yeah,
for the.
it's not ethical.
Alright, thank you Amira for the very great information about the ethical issue. And the other one I would like to share is about the another treatment is the one another treatment is gene therapy treatment. They want to use for the children, and this treatment is not yet fully valid to the children because there is some limitation also and arguments about the gene therapy treatment, which are some of the arguments are how to obtain the normal gene to replace to the defective gene, which is which is the arguments that arise among them. And after we insert the gene into the correct gene into the cell, the next problem is getting it to go to the right place. As we know that if you want to insert a gene into the whole cell, you must need a vector, right? Okay, and the vector, whether it's a viral or non-viral, this is the issues which we do not guarantee that the vector is carrying the healthy genes is that the gene will go to the right place. That's the ethical issue, and parents have ethical and legal rights to make decisions on behalf of the child, whether they want to be tested or not to be tested. That's the right for the parents. Okay, so that's the ethical issues, some of the ethical issues, and what we hope that for the increased experience among the researchers, improved preservation methods and better surgical techniques, maybe for the future is there will many more treatments could be available for the patient with cystic fibrosis. That's all from us.